CD Illeus. Illeus is the loss of peristalsis due to some cause that is not obstruction. So, loss of peristalsis without obstruction, the most common cause would be post-surgery, and this is, in a sense, the most common complication, surgery, or gastrointestinal procedures. Also, some electrolyte abnormalities like hypokalemia, and we should also check the calcium, hypothyroidism, and diabetes mellitus, and some medications that decreases the bowel movements like anticholinergic drugs or opioid. The clinical presentation would be constant or diffuse abdominal discomfort with nausea or vomiting. And on the physical examination, quite the same thing, the tenderness, diffuse abdominal tenderness. The diagnosis, we need to take into account the clinical history. This would be very important, clinical history. The best initial test would be a abdominal film, abdominal X-ray, that will show distended loops in the small and large intestines throughout all the small and large intestine. This, as opposed to let's say small bowel obstruction, the distended loops are proximal to the obstruction. Further or distal to the obstruction, there is no distended loops, and here we have distended loops through all the small and large intestine. So this is, in a sense, the way how we differentiate these two conditions. And the most accurate test would be the CT scan of the abdomen. The treatment would be temporarily reduce the enteral feed, reduce or discontinue. In some cases, we will need to give parenteral nutrition, and we want to rule out some impactation, so we will do a nasogastric suction. And in elderly patients, we need to rule out stool constipation. So in the rectal examination, we will need to be cautious about that. And discontinue all the opioid medications or anticholinergic medications that could be causing this ileus. So this is called paralytic ileus, in which the patient loses the peristalsis, not to a obstruction cause, and the diagnosis or the management in evaluation involves the abdominal X-ray, in which we will see the distended loops through all the small and large intestine, and the confirmatory test with the CT scan.